Florida is breaking new ground in a way that's already stirring up debate across the nation. On Wednesday, Florida Surgeon General Dr. Ladapo stood before reporters and made an announcement that could reshape public health in the state. He said Florida will move to end all vaccine mandates. If this happened, Florida would be the first state in America to fully eliminate these requirements. Standing alongside Dr. Ladapo was Governor Ron DeSantis, who backed the decision. DeSantis explained that lawmakers will put together a legislative package to clear out any remaining mandates, making sure this change is permanent. Dr. Ladapo didn't mince words. He declared that vaccine mandates are wrong and compared them to slavery. He argued that every Floridian should have the power to decide what goes into their body without interference from the government. For decades, though, vaccine requirements have been a staple for public health in America. Since the 1980s, all 50 states have required children to be vaccinated before entering school. These shots protect against deadly diseases like measles, polio, and tetanus diseases that once devastated communities before vaccines were widely available. It's important to note, no state currently requires COVID-19 vaccine for school children, but traditional vaccines, the ones that have been around for generations, remain part of the school entry process. An exemption already exists. Parents can opt out for medical reasons, and most states, including Florida, also allow personal or religious exceptions. This expansion, however, has been growing. In fact, last year, the CDC reported that a record number of kindergarteners nationwide entered school without their required shots. In Florida, about 5% of the children were exempt, higher than the national average, and most of those were for non-medical reasons. This is why many health experts are worried about the Florida decision. Dr. Rana Alisa, president of the Florida chapter of the American Academy of Pediatrics, says this move could put children at greater risk. She pointed out that schools are natural places for close contact. Kids play, share, and learn together. When vaccination rates drop, it becomes much easier for disease to spread. And the consequences can ripple outward. Kids missing class means parents miss work, and families and local economies feel the strain. A study from the CDC last year showed that just how powerful vaccines has been. For children born between 1994 and 2003, routine vaccine prevented more than 500 million illnesses, saved over 1 million lives, and cut health costs by estimated $540 billion. Still, Dr. Ladapo insists it's about freedom. He said decisions about vaccines should be personal, guided by one's own beliefs and a relationship with God, not by government. But not everyone agrees. Dr. Kelly Moore, president of Immunize Organization, compared vaccine mandates to other rules designed to keep people safe. We all obey speed limits, wear seatbelts, and use infant car seats, she said, because these protections save lives. She argues children in schools deserve the same kind of protection against diseases. Florida's bold step raises a larger question for the entire country. How do we balance individual freedom with community safety? This debate is only just beginning.